I have close to me a very good friend, and not only a very good friend, but a very good teacher, a very good educator. And if you don't know him, he's Alex. I will let him present himself a little bit more. You want to be formal, or you want to be Mr. Professor Alexandros Sideris, or
I do not consider myself a professor, but just an educator. But we know, I think, long enough to be not that formal.
Is there a difference between being an educator and being a professor?
Well, it should be, because the correct word for someone who gives knowledge and information to people is being a teacher or being an educator, while professors are in the university. We tend to use this word, but I think we should pay respect to academic professors.
Definitely.
And keep the humble word teacher for ourselves.
Okay.
Our students are calling us that.
I think it's more than fair, because if being a professor comes with being integrated into a university biosphere, why not? And what drives you in what made you become an educator, a teacher, and what is still driving you of doing this?
Well, to tell you the truth, I realized I enjoy giving my knowledge and passing my knowledge to other people as I was a physiotherapist. So in the beginning of my career, I'm close to 50 years old now. Not yet 50, but 49. But anyway, I remember myself feeling really happy about when I was explaining to my patients about their conditions, what I was going to do to them. And I realized the more time I spent talking to them, the better the outcomes were. So as I was growing as a young clinician, I realized I could pass some of this information to other younger physios than me. And this thing started around 15 years ago. So now I consider myself having this 15 years of experience teaching physiotherapists in a postgraduate level. In the last 3 or 4 years, I am honored to be a teacher, a clinical educator in Medical School of Athens, master's degree, in University of West Attica, postgraduate diplomas, in pain management, in acupuncture, in manual therapy. So that's what I do, and I enjoy it.
Which is more difficult, teaching the patient or teaching the students, the physical therapists?
Good question. Well, the patient might seem easier because you can use easier, simpler schemes, simpler ways of explaining about his condition, about how you're gonna help him get better. The student needs a more scholar language, which is also something that it is a bit challenging sometimes. I enjoy both. I think I enjoy both, and I'm very happy that I can do both.
What is your main, or where did you spend in the last years your most time, teaching or treating patients?
Well, to tell you the truth, in the last 10 years, the need for postgraduate education grew a lot. I've seen it growing all around Europe. I've been visiting world congresses in physiotherapy. I think I remember my first was in 2011 in Amsterdam, where I got this fantastic feedback from, as we call them in Greek, holy monsters of the profession. And so from the beginning of 2010, 2011, things started to shift for me. And now, 12, 13 years after that, I would say that teaching takes more than 50% of my time and of my effort. So I might say 1/3 clinician, 2/3 educator.
This is a very nice ratio, 1 to 2. What do you think? Could you be such a, because you are a very good facilitator, your skills in adapting to the students and to the classroom and to the questions are excellent, and you are very aware of it. But could you be as good if you would not treat patients?
Good question. No, I wouldn't. And I will try not to lose this connection. The problem with healthcare professions and university teachers is sometimes that they fall a bit behind in their research and their teaching. They fall a bit behind on dealing with patients. So I'm trying to find this golden ratio. Golden ratio is not 1/3, 2/3, but a bit more than 1/3, a bit less than 2/3. So that's what I'm trying to do. If I do not keep on seeing patients, I feel that I will not be able to get better, and I get better every year. I consider, I reflect on myself, doing this, the same area. For example, we talk about pain science, and I realize the way I teach now and the way I was teaching the same thing 5 years ago has a difference. Maybe not in the actual knowledge, but in the actual depth and meaning, the way that I should present the actual thing. So yes, I have to keep on seeing patients, and I will try and do that for the rest of my career.
Are you still participating to courses as a student? Do you think that this is a necessary thing that an educator should have in her life?
Always. Once a year at least, I will follow an important event around the world, or I will try not to miss an important lecturer that is coming to my country or to a country close to Greece that I live and work most of the times. You can't get better if you do not meet with people who are better than you. So I keep on trying to do that, yes.
Which was the latest challenge that you took in this direction? The latest course that you, or exam that you had in the last year?
Well, because we are in the year 2023, we just got out from a dark period for knowledge. It was the period 2020, 2022, which due to COVID restrictions, moving around wasn't easy. But in this period of time, I will say that I got this great decision to follow and deepen my understanding in pain science. So I followed a very good friend. He's Dr. Morten Hoig. He's Danish. He's an expert in pain science. So I have followed him for the last 2 or 3 years. I know you know him and you follow him too. And I followed his advice, and I managed with 2 of my colleagues and to pass this new institution that the European Society of Pain Science, EFIC as it is. We passed through an exam that they have formed for physiotherapists to be announced as a pain physiotherapist. There is this great work they've done there. So it's a diploma for physicians, for doctors, a diploma for physiotherapists in pain, for psychologists and for nurses. So I'm very happy I did that. I was again examined, which is also good, very good for teachers to get back on the
opposite side
on the opposite side of the person who gets examined. And I remember a bit of the adrenaline. People who I see them socially and I read about them, they were testing us about our, I might say, basic knowledge on pain. It was a thing. And it makes me understand how stressed students are when you are being examined. So it reminds me to be, as
humane.
much. I think I'm always humane. I just don't want to be strict for no reason. I mean, stress is an important thing, and we have to get over this before we go on with an examination. That's a different subject. So yes, this is what I've done lately. I have a couple of people who have been following in the last years. One of my best experience was 1.5 years ago, where I met Phil Glasgow, and I followed his course in Greece. Phil Glasgow is one of the most well-renowned sports physiotherapists in the world. Great guy, really nice to discuss with. He wants to be a doctor of philosophy. Great Irish guy with a very wide range of interests. So yes, as you see, if I keep on thinking, I might think about some more things that I do. So every year, yes, I continue to do that as much as I can.
So do you have one final thought or one final goal in you being a teacher, or in this direction of being an educator?
Well, I've been thinking lately. One of the things that made me even more to become an educator and continue of what I was doing about my patients was this speech I heard from David Butler, the famous David Butler, in 2011 in Amsterdam, World Confederation of Physical Therapy Congress. Also a year ago, 2010, in the NOI Congress in Nottingham. So David Butler kept on saying, think of physios as therapeutic educators. I kept on saying that, and now I realize that after 10, 15 years of doing this, I start to realize the younger physios that have come through, for example, from my courses, and I see them now talking to patients, and I see them now in a teaching position. And I feel so happy that I realize that a new generation of people has changed the way we see physiotherapy. It has evolved the profession. The profession is not just an applied technical profession. It's an applied science, what we do. And the aspects of this applied science, physiotherapy, are growing as the years go by, and I feel I have helped just a little bit in this way, in this course, and I'm very, very happy about it. And I know that in maybe a few years, what I say will not be as important for other people, but there will be others, younger ones, who are going to do this even better than I do it.
Thank you very much, Alex.
Thank you for your time.